In this TED Talk, Niels Van Nieman talks about hospitals, why people don't like them, why people avoid them, and how they could be better. He explains that a lot of people, mostly the elderly and the poor people, avoid going to hospitals because transportation is an issue or there's a lack of hospitals in their area. Also, they avoid hospitals because of the cost and fail to get proper treatment. This is a big problem in poor countries and in rural areas, but is the biggest problem in Sweden. According to recent studies, 64% of patients avoid hospital care due to costs. Neil Van Nieman says in this TED Talk that even when patients do get proper care, the hospital makes them even more sick or disabled than before they came. The third leading cause of death in the world is medical mistakes and errors following heart disease and cancer. This could be due to the fact that medical doctors are burnt out. Recent studies show that in Japan, 4 out of 10 medical doctors are burnt out, and in the United States, 5 out of 10 are also burnt out. There are also short nurses in a lot of places, putting more stress on the nurses that are working. This is most prominent in the Netherlands. They are short about 125,000 nurses. Over the past years, we have made a lot of medical advances. We have discovered insulin, we have made pacemakers, we have made x-rays, and we have made advances with cell and gene therapy. But one thing that has not changed since the time of the ancient Greeks is how we run our hospitals. Niels Van Nieman makes a claim that we need to forget our current healthcare system and switch to more home-based hospital care. I agree with him. Recent studies show that 46% of hospital care can be done from the comfort of your own home. And this is mostly care for patients with chronic illnesses and conditions. Intensive care, surgery, neonatology, and imaging will still be done in hospitals, but routine work like blood drawings, basic tests, and checkups will be done from your own home. Patients with chronic illnesses like cancer spend more time in the hospital traveling to and from the hospital and spending time with their loved ones before they pass away. Because of this, a lot of patients choose to avoid going to the hospital. According to recent studies, patients 70 to 85 and older leave the hospital more disabled than when they came. Most costs at a hospital are for the bed and for the food. Healthcare prices have increased 6% recently, mostly due to renovations of the hospitals. Because of this, I believe that at-home healthcare is the next big step that should be taken into consideration to improve the satisfaction of patients, especially those who do not have access to proper healthcare, do not have insurance, or do not have transportation. This would also be a good option for patients looking to spend more time at home with their loved ones during their last months.